Hello, welcome to our presentation. Today we are going to talk about why you should hire an occupational therapy assistant. This presentation was put together by myself, Haley Phillips, Audrey McLemore, Josh Freeman, and Jessica Fox. We are current occupational therapy assistant students at Wallace State Community College in Huntsville, Alabama. So why? Why should you hire an occupational therapy assistant? You may be thinking, I have plenty of occupational therapists. What can an OTA provide to me that an OT can't provide? So that's what we're going to talk about today, and we hope that you learn a lot from our presentation. So one thing we want to focus on in this presentation is the lack of occupational therapy assistants in pediatric outpatient settings. In my experience alone, places I've shadowed and places I've done field work at, they utilize so many occupational therapists, but there is a lack of occupational therapy assistants in the clinic. And that is something we want to talk about. So, what makes an OTA stand out? What are their requirements? What do they know how to do? What can they do? Good question. So, occupational therapy assistants are required to graduate from an accredited program within a college. Some are in community colleges, some are at universities. Most of them graduate with an associate's degree in science or applied science, and some even hold a bachelor's degree in other fields or within other programs, which make them very well-rounded. So, within the Occupational Therapy Assistant program, students learn medical terminology, anatomy and physiology, psychology, rehab theory. They also learn about pediatrics and geriatrics, splinting. We learn some management skills as well. We learn about mental health and group theory, splinting. We also learn medical conditions and then some technical aspects of occupational therapy, such as the different modalities as well as learning range of motion. So, occupational therapists can work in a variety of settings. Some can work in a hospital, a school, home health, or a SNF, but we really see a lack of OTAs in the outpatient pediatric setting right now, so that's what we're focusing on today. So once these occupational therapy assistants finish school, they have to sit for the NBCOT to be board certified, just like an occupational therapist does. Once they pass that, they apply for their license, and they're licensed to practice in their state. Each state varies by requirements, but every state you do have to have a license to practice. Some of the things we're going to point out today in this presentation as to what an occupational therapy assistant may provide for your clinic would be the achievement of the continuity of care by utilizing the OTA. So just talking about how always having that same therapist or that same assistant with the client can provide a really good rapport. We're going to talk about the paperwork responsibilities. What does an occupational therapist have to do that an OTA may not have to do? We're also going to talk about scheduling opportunities and how you can use an OTA for group therapy as well. And we're also going to talk about the salary difference between an OTA and an OT in relation to facility revenue generation. The first objective that we're going to dive into is the achievement of the continuity of care by utilizing an occupational therapy assistant. So, continuity of care. So, the continuity of care is the quality of care over a course of a treatment time. So, maybe this patient needs 5 weeks of therapy or a year of therapy, whatever it may be. The continuity of care is the quality of care that's provided from the day they walk in to the day they walk out and they're discharged. So, one way that OTAs can contribute to the overall continuity of care is being that practitioner for a particular patient. Like they're their go-to, they're the main one. OTs focus heavily on evaluations because an OTA cannot perform an evaluation. And they also are responsible for doing the assessments on the patient, intake, and all types of stuff to learn about this patient and then write their goals and come up with things that these patients need to work on. An OTA then comes in and says, hey, okay, here's what the OT has given me goal-wise, and they have the creativity and the flexibility to come up with all kinds of great and wonderful treatment implementation ideas. So it is super important that a patient gets the same therapist over and over and over. So research actually shows that the critical development of the patient-practitioner relationship starts early on in those first few sessions, building the relationship, the trust, and the rapport, whether it be a client at a skilled nursing facility or a client in a pediatric outpatient setting. And that's also really important that you build that rapport with their parents as well, and even their caregivers and their family members. Whoever's involved in their treatment team, you want to make sure that you build a really, really good rapport with them. And the best way to do that is just to keep the same therapist over and over and over and over. You really get to know that person and you get to know what they like. So, the best way to do that is the optimum outcomes result from the continuity of care. So, what does this look like? For example, so I got, let's say, Sally as a patient. The OT has already avowed her, and we know what her goals are. The OT gave me those goals, and I've got to come up with some really cool treatment implementation for Sally. So, Sally is, let's say she's a 5-year-old girl, and she's really into hot pink, and she likes to play with ball, and she likes to color and do all of the fun things that a 5-year-old girl loves to do. Well, because I see her every single day and I'm always with Sally, I really know that about her. So when she comes in, I know what to say to Sally. I know how to greet her. I know what her mom likes. I know what her mom doesn't like. I know what her favorite foods are, and all these things you learn just throughout your treatment session while you're talking to these patients. So it's just so important that you really get to know them, and the only way you can do that is if they're always seeing the same therapist. And the way that OTAs come in, obviously occupational therapists can see the same people all the time. However, an OTA is never going to be asked to eval a patient because they can't do that. That's not part of their training, and they just legally cannot eval a patient. So that frees them up in their schedule to have the same patient all the time, back to back to back. So I start seeing Sally when she's 5. Well, say she's still coming to therapy when she's 8. We've changed her goals. The OTR has obviously changed her goals because she's hopefully met a bunch of them. And I've got to see this patient grow. I know where she started, and I also know where she wants to go. And that really comes from just being with this patient. And you get to watch them grow as they progress through treatment. That's a really good example of what I've seen in my current level 2A field work, is that some of these patients have been coming to this specific clinic since they were 4 and now they're 16. And so, yeah, they have new goals. And some of these patients will probably always need therapy and they have new goals, but they have such a great relationship with their OTA because they know them, like they know who they are. It's like their best friend. And so that really helps with social skills as well, especially some of these kids that really need that. Super, super important. Research also shows that, and we'll go to the next slide. This research was done, and it wasn't specifically related to occupational therapy, but just in general, patients say that the most important thing to them is the continuity of care, the quality of care over the time span. And I'm telling you, just the best way to do that is to have the same therapist. So like I said, an OTR evals this patient, and they may see them the next time they come in, but then after that, another patient has walked in during that patient's time slot, and they have to eval them, so they get thrown to another therapist. Well, maybe that sets that child back. It could set them back, everything that they've been working on and the establishment. And obviously, sometimes we have to do that. A therapist can't be expected to be there every single day for however many years this patient comes. Things come up, family gets sick, they get sick. Obviously, that changes over time, But just in general, keeping the same person over and over and over, it just really builds that bond and that trust. And like I said, you get to really, really know that patient. So that is super, super cool that I've actually got to experience that, see just a snippet of what this relationship looks like with this therapist that this patient has been coming to for years. It's like, a family member. You become their family and you know so much about them. So that's just super, super cool and really important. So I'm going to go back one slide. So again, let's talk more about like what the patient, what the client likes and dislikes. Another example I have a patient that is they can't stand loud noises. So the therapist that I've been with, she knows to take this specific patient to a room with, the lighting is really low. They have mood lighting almost in there, like with the Christmas lights, and we try not to have lots of loud noises because this patient just does not do well under conditions where he can hear other children or people talking and just distracting him. He doesn't do well. So it's just super cool that that therapist knows that much about that child, that that's where he performs best and that's where he gets his best therapy, is when he is alone and not around a bunch of other people. But then maybe you have a temporary therapist come in or you switch therapist on him because the OTR he was with has to do an eval and can't be with her patient that day, and they don't know that, so they put him in the therapy gym, and he just has the worst treatment session. So that's 30 minutes to an hour, however much time you have to spend with this patient, that just gets wiped. It just gets wiped from you because they have just a really bad day, and all kids, clients, just anybody can have a really bad day. Any day, any of us can. It's just but when you know that that child is not going to perform well in a situation, just having that rapport and that continuity of care, being able to use the occupational therapy assistant over and over and over for that one patient and just building that up, knowing what the patient likes, knowing what they dislike, and taking him into the situation where you know he performs best and you get the best 30 minutes to an hour, however long you have out of him for his session. And that's what we want. We don't want any wasted session. Some people come in and they may only have 14 days. So every day that you spend with them is so important. Teaching the family education on how to perform these different skills and tips and tricks and resources we have to provide for these families once they leave therapy, once their insurance is no longer paying for it, or they have to leave the hospital, or they have to leave the assisted living facility. Whatever the situation may be, it's just so important that that continuity of care is there, and you're providing them with the best quality. And that's really where OTAs come in, because it's like, they don't have to do the evals, they don't have to do the assessments, they're not getting pulled here and pulled there. Some, even if you have multiple facilities, the OTR is running here, they're running there, just going everywhere, and they're maybe not always in the clinic where an OTA can be. And that's where it's really important that you have OTAs at your clinic and you're utilizing these OTAs for your scheduling, for your continuity of care. It's so important. And OTAs are trained and skilled in so many things. They can have certifications, and we'll touch more on that in some other parts of this presentation. But it's just so important to know that OTAs are great. They're wonderful. They can do so much, and I think so many people don't realize the potential of an occupational therapy assistant. And so many people that most people that come into occupational therapy, they're passionate about it. They love these patients and they want to give them the best quality that they can give them. So it's just so important that we have that continuity of care, and I really think an OTA is the best person to provide that for them. They're not getting pulled in a million directions, and they can have a set schedule. Every Monday they have Jane come in for therapy. They know at 9 a.m. every Monday Jane comes to therapy. Every Tuesday at 4 p.m. Jack comes for therapy. They know what Jack likes. They know what Jane likes. And it makes creating a treatment plan so much easier when you know what these children like. So I really think that that's so important, and I think you should really hire OTAs even if it's for that reason only.
This is Josh, and we will be discussing the responsibilities of paperwork. Question for you is, why is paperwork important to occupational therapy? If I asked you that question, most people who've honestly never really heard of occupational therapy would be like, paperwork's not that important. It's nobody looks at it. Nobody pays attention to it. It's not really important, so why even have to do paperwork? Well, that's where those people are wrong, because paperwork is one of the most responsible things in OT and OTA. We can tell if the client is progressing or if he's declining. And as OT and OTAs, we work together for that common goal of making that particular patient independent as possible. Paperwork is also a huge responsibility, not only for yourself, but it's a big thing for the patients too, because they're able to see how they are doing as they are doing the treatment planning. OT's responsibilities, there's 3 things. The first thing is evaluation, the second thing is assess, and the third thing is they're allowed to score patients. How they are set apart from OTAs is how they are able to evaluate patients. When becoming an OTA, that is not one of your responsibilities, is to do evaluations. It's important for OTs to stay up to date on doctor's notes, nurses, and other types of notes that might be dealing with that patient before they go and do an evaluation. Evaluations for OTs allow them to assess the patient and ask questions and just have like a normal conversation with them to see how they are doing and ask them about maybe some of their goals that they have set for themselves. Evaluations are very important type of paperwork because this is the first initiation for the patient to be able to have the services of occupational therapy. The second thing that is important about OTAs and their paperwork is the assessments. They're able to assess patients, and also, like I said, the third thing is score them on how they might be doing on different types of activities that they are doing. And some places call it acuity, and some different places call it different things, but I'm going to say acuity. They can choose if they're declining, they could lower their acuity to make sure that they're seen and get all the visits that they can, or they can up their acuity where they see them, but they know that they're progressing towards their goals and they're progressing being more independent. A good example of an assessment is that OTs can do is a sensory assessment. And when talking about a sensory assessment, it takes about an hour to score. So OTs might not see as many patients as OTAs can because evaluations might take longer. Say OTs might have 5 or 6 patients, but it might take all day for them to see them because they have to go do evaluations all day. whereas OTAs can go out on the floor and see 12 to 13 patients, maybe even more than that, by the time that they're done, the OTs are done with evaluations. So evaluations, assessments, and how OTs are able to score on their assessments is a very important thing for OTs to do with their paperwork. The responsibilities for OTAs are two things: documenting and treating. Paperwork, talking about OTA's paperwork, which is documenting, it's very important. Like they tell us in school, CYA, to cover your butt. It covers your butt just in case if something does happen. Not only is this type of paperwork helpful for you, but it keeps everybody up to date on the patient status. And that's why paperwork is so important, because it keeps everybody all together working on progressing the patient. Most of the time spent that patients get with OTAs is treating and documentation. And I believe that sets aside OTAs from OTs, because they have more time in their day to go and see more patients and go treat more patients, and basically all they have to do is document how they were doing that day, the activity, and what they did. While OTs have to do evaluations and, like I said, do acuities when needed. And while OTs and OTAs might be a little different, they also have stuff that are in common together. OTAs and OTs track goals and progress patients. They're able to work together through that paperwork, through documenting. They're able to see how the patients are doing every day, either declining or they're progressing. The second thing is they're able to document information that happened during treatment time. So that goes to say again that it covers everything that you did during that treatment time, and it helps not only for us as OTAs and OTs, but it helps the doctors, the nurses, anybody that might be coming in contact with that patient. It helps them to see, hey, this patient was doing this day, and it's declining today. And it keeps everybody up to date. Also, what paperwork does for OTs and OTAs, we have an intervention plan. It can say supervisor visits with date, time, and signature. Team meetings report the topic, outcome, and therapist responsibilities. Paperwork also shows their phone calls and also equipment change or modifications. So to me, paperwork is super, super important, and it does not need to be taken lightly, because it shows how we as OT and OTAs are doing, and how we document shows how we are working together to make that patient independent as possible.
This is Audrey McLemore, and today I'll be presenting why you should hire OTAs and scheduling opportunities for an OTA. So the objective that I'll be covering today is scheduling opportunities using OTAs for established patients and group therapy. And my first point is that OTAs have the ability to lead various groups. And just a few groups that they can lead are mental health groups, social skills group, coping skills groups, sensory groups, self-management groups, and community groups. All of these groups involve multiple conditions and multiple different clients. So with an OTA leading a group versus an OT, this obviously reduces the cost for facilities because it's a lot cheaper for OTAs to be billed than an OT. On Wiley Online Library, there is an article, and it's titled Implementation of an Advanced Occupational Therapy Assistant-Led Groups Program in Aged Care Rehabilitation. So this article talks about how there was a trial conducted there were two different groups, and an OT led a group and an OTA led a group. So each of their groups involved 6 groups per week, and it was with the clients of the aged care rehabilitation facility. During the groups, they just conducted meal prep activities and different ADL activities. So the results from the trial were that discharge results and outcomes were not significantly different between the two groups. And the groups, they did not result in a decline in patient outcomes. So both of the outcomes from the OT-led group and the OTA-led group were the same. So this pretty much proves that an OTA leading a group and an OT leading a group will provide the same intervention for the client. So if an OTA is skilled in leading a group, it'll be beneficial for a facility or any type of setting to have the OTA lead the group. So another point that I'm going to talk about today is how OTAs can build a rapport with clients, because after OT evaluation, OTAs can provide treatment to clients. So after an OT conducts an evaluation, the OTA is able to see the patients more and build a better relationship with them, because they typically provide more treatments to the clients. So the OT will be there to evaluate and keep in touch with the OTA to see how the client is doing, and the OT will also be there to write the discharge for the client. But with the OTAs being able to provide treatment to the clients, this just helps them see them more and build a better relationship. And also, with building a relationship, the client is able to express their needs more and really open up with the OTA and maybe tell the OTA some things that the OT might not have known, because they don't see the client as much, or maybe they're not as close. The client don't feel as comfortable speaking with the OT. So the last point that I'm going to talk about today is how OTAs can become certified in various specialties. So I have just a few that I want to talk about today. The first one is driving and community mobility. So if an OTA becomes certified in this would involve, or this could involve, helping a client get in and out of their car, or it could be public transportation such as a subway or a train, and it can involve anything that allows the client to become involved more in their community. Another certification that OTAs can become certified in is environmental modification. So this would involve reorganizing the client's home. It could be moving furniture around, bringing in adaptive equipment. It could involve really anything that makes the client's environment more safe for them and help them adapt based on their needs. Another certification for OTAs is feeding, eating, and swallowing. So a lot of OTAs become certified in this to work in pediatrics, and also with older adults. So feeding is we need it for basic health. So if a client is having trouble feeding, eating, and swallowing, and they're not getting proper nutrients and proper nourishment, then they're not able to participate in therapy. It'll make it a lot harder for them, but it involves a lot of pediatric clients. And then another certification involving pediatric clients is handwriting certification. So with handwriting certification, this would involve fine motor skills. It'll be grasping a pencil, writing letters. It'll be anything that it improves academic success. So with hiring an OTA, there's a lot of opportunities and a lot of cost reduction rather than hiring an OT. I've talked about the various groups that they can lead and how they're involved with their clients and how they can become certified in various specialties. So obviously with these groups and specialties, they want to have a higher education on this and become skilled before they attempt to do this, and they want to be competent in everything that the group involves. So with the article that I talked about earlier, it expressed how the trial would vary if it was between maybe a different OTA or an OT. So each OT or OTA conducts treatments a little bit different, but if they're competent in the certain skill, then the results should be the same. Okay, so next point. Thank you.
Okay, so I'm going to discuss why you should hire occupational therapy assistants because of their salary. The charts I have here are from the U.S. Bureau of Labor and Statistics. They show the difference between the median earnings of occupational therapists and of occupational therapy assistants. These numbers are from the 2019 earnings. As you can see, occupational therapists' pay is significantly larger than that of occupational therapy assistants. With some of the higher earnings from occupational therapists being almost doubled that of occupational therapy assistants. But why? Occupational therapists earn an entry-level master's degree or an entry-level doctoral degree. They go to school for longer, and they also have more responsibilities than occupational therapy assistants once they are graduated in the job. While occupational therapy assistants can earn an associate's degree in just 2 years and then go to work under an occupational therapist. There are almost triple the amount of jobs for occupational therapists as there are for occupational therapy assistants. The 2019 current number of jobs for occupational therapists was 133,000, as opposed to almost 52,000 occupational therapy assistant jobs. But the job outlook for occupational therapy assistants is growing at a rate of 31% and much faster than average. So what does that mean for job placements and salary? Therapy companies across America can hire less occupational therapists at their companies and more occupational therapy assistants. A company can hire one occupational therapist to have on staff and then several occupational therapy assistants. But why? Because in some cases, regarding their salary differences, companies can hire 2 or 3 occupational therapy assistants to one occupational therapist. So how does salary differences affect a company's revenue? Good question. A company can hire one occupational therapist to oversee the occupational therapy assistants, to focus on their paperwork and the handling the initial evaluations of the patients or clients. The company can then hire and staff more occupational therapy assistants to cover the caseloads and to treat all of those patients, especially in outpatient or day treatment facilities or in skilled nursing home facilities that also have a rehab center on site. Companies can fill up occupational therapy assistants' schedules to treat as many patients back to back. So the more occupational therapy assistants a company has working in their clinics and therapy rooms, the more patients and clients they can treat. By having occupational therapy assistants and their lesser salaries, along with the increasing amount of therapy being given to individuals, the overall increase and can bring in more revenue for those companies. One example is an outpatient clinic can staff one occupational therapist that can focus on bringing in all of the new patients and doing their evaluations. Then the occupational therapy assistant can fill all of their time focusing on treating the patients without having to deal with all of the responsibilities of the occupational therapist. Treating more patients equals more revenue, more money, and more productivity for companies. But with the pending Medicare Part B changes, the occupational therapy services are looking at a 15% pay cut, bringing the payout to 85% for services where occupational therapy assistants assisted in whole or in part of therapy services. This will impact salaries for everyone across the board including occupational therapists and occupational therapy assistants. This is why it is so important for us to advocate for our profession. We hope more people will consider hiring occupational therapy assistants for their continuity of care, their great paperwork responsibilities, scheduling opportunities, and for their salaries. We hope you have learned For our conclusion to this presentation, we hope you have learned the achievement of continuity of care utilizing occupational therapy assistants. We hope you have a better understanding of our paperwork responsibilities of an occupational therapist and of occupational therapy assistants and how it relates to facility productivity. We hope that you understand our scheduling opportunities when using occupational therapy assistants for established patients and for group therapy. And we hope that you understand salary differences between an occupational therapist and an occupational therapy assistant. Occupational therapy assistants are equipped with knowledge, skills, and the tools to help guide you to a more cost-effective facility with great productivity outcomes. We hope you have enjoyed our presentation on why you should hire occupational therapy assistants. This presentation was done by Haley Phillips, Audrey McLemore, Josh Freeman, and Jessica Fox. Thank you.